public awareness of many varieties of cancer has grown, but for some women, ovarian cancer remains scary and unfamiliar. Dr. Dwayne Jenkins demystifies the condition.
Ovarian cancer is a cancer that starts in the ovaries, so by definition. And in the grand scheme of things, it's not a very common cancer. So only 1 in 70, 1 in 72 women will be affected with ovarian cancer in their lifetimes. But in this state, that's about 1,500 women a year. In the country, it's about 22,000 women a year. So those sound like huge numbers, and it certainly gets people's attention because it's such a difficult problem to treat. But in the grand scheme of things, it is a rare cancer. So the vast majority of ovarian cancer that occurs is not related to family history, which is the risk factor that most people are concerned about. But other things such as having children or not having children, taking birth control pills, not taking birth control pills, breastfeeding, those type of lifestyle and health-related choices much more profoundly impact the risk of ovarian cancer over a woman's lifetime than family history does. In the vast majority of cases, only about 10% of cancers are related to family history. So 9 out of 10 times, the cancer is a chance event, for lack of a better word. The symptoms are actually very common things that we all experience on a fairly common basis, like indigestion, bloating, decreased appetite, abdominal pain, nausea. We all have those things from time to time, but when those things persist, for days, weeks, and God forbid months, and don't go away, that's when a patient should, without question, seek medical care. Sometimes it's caught because on an exam, a mass is felt, and then an ultrasound or some other imaging study is performed, which picks up the cancer. And very often those are the cases in which the cancer is early. Diagnosis is without question the biggest challenge with this cancer. And so certainly as we understand more about the impact of family history and are able to identify people whose risk is increased over the population risk significantly, we can get those people into special screening programs. As we understand more about the genomic or the DNA behavior of the ovarian cancer, there's actually blood tests which are being developed, and some of which are increasingly available, which can help to identify signatures, genomic signatures that patients may have that put them at an increased risk long term. These are all technologies that are very much in development. They're a long ways from being available at the bedside, so to speak. But this is where we think the future will be with regard to picking up this cancer early and helping to bend the curve, on the negative impact that this has on our patients' survival, shortening their lifespans.
Texas Oncology provides free educational resources to learn more about ovarian cancer and the latest advances in detection and treatment. Visit their website at www.texasoncology.com. You can also find health and wellness resources at Memorial Hermann Hospital's website at www.memorialhermann.org. For Healthwise, I'm Stacy Hawkins.